and welcome to Charlestown and Beyond. I'm Kathy Giordano. It's a pleasure to be with you again this week. This week's show is going to introduce to you the new Health Charlestown, the new health center down in Hayes Square on Vine Street. And to get right into the show, let me introduce my guests. First, we have Dr. Ann Murray-Chiribogo. Chiribogo, she's the medical director. And also Dr. Yulya Kutsman, family practice.
Yeah.
Now, you know, this is an Irish girl, and I didn't do that bad
messing
up your names, okay?
Wonderful.
So this is going to be fun.
You're awesome.
So, New Health Charlestown, when did you open?
We opened in December of last year, and we've been open just over 6 months, right?
Yeah, getting there,
And it's been a wonderful experience so far. We're learning a lot about your incredible community.
Oh, yeah. It's a great new service for Charlestown. Thank you so much for coming in and joining the community.
Yeah.
So what services do you offer down there?
So we have comprehensive family medicine service that includes internal medicine, pediatrics, includes obstetrical care, and we're also working on building an integrative psychiatric health department.
Oh my.
Yeah, well, lots of projects in the works.
Yeah.
And there's also dental and vision services that are open now.
That's unique.
Yeah.
That's wonderful.
Yeah.
And I was able to visit the health center and take some photos. It's gorgeous down there, it really is. And if we can show those photos right now, David, that would be helpful. Here we go. This is your main door on Vine Street.
Yeah.
And it's really beautiful inside. You want to talk to me about the site?
Well, you may know, I don't know as much about the history. I know from people coming in that it was an old school, right? It was a school.
St. Catherine's School.
That's
yes.
right. And right now,
Oops.
oh, well,
There's
that's the
your
first floor.
health
We
van.
take the whole first floor. That's our van, and we transport people actually who need to go to the North End free of charge to do additional services, which we have there,
great.
podiatry and x-ray.
Wow.
So if somebody needs care and we can't provide it on site, we will bring them to the North End and then back.
Great. Now, the North End,
Limousines.
we're talking about the existing
The
center on Hanover Street.
Yeah, our
right?
parent site, right.
Yeah.
Your parents'
Right,
site.
parent site.
Okay.
We're a satellite of that site.
And before, I know we've gone into one of the lobbies, but please give me that gentleman's name who drives the van.
Oh, Jimmy Bolognese.
Oh, nice man.
Yeah,
nice
lovely
man. I
man.
got
We're
to meet
very-
him.
yeah.
So what do we have here?
Here's the lobby for our family medicine site. So this is where you would come initially if you were going to see one of us or the social worker. And this is, and then on the other side of the hall is our dental department, where we have state-of-the-art.
Let's talk about dental. Now, I understand that you have dental services from Monday through Thursday.
Monday through Thursday.
So people can come down and make an appointment first, I'm sure.
Yeah, well, you should know also they have early morning appointments.
Oh, good.
On Tuesdays and Wednesdays.
Oh, so
and
people
then they
go and
have
go to
evening
work.
hours.
Extending evening hours
Oh, isn't
Yeah.
that
till 6:30 so
wonderful?
people can come off their work.
And the other thing that I think is important to mention is that we accept a lot of different insurances.
Yes, I wanted to ask you
Yeah.
about that. Let's go through the photos
okay.
first so they can see the facility. Oh, look at this.
So we have a vision department as well, which is also open Wednesday and Thursday.
Oh, that's wonderful.
Yeah. We have a
Look at that
wonderful
beautiful
optometrist
state-of-the-art
there.
facility. Wow.
And they do provide full range vision services, so it's not just for people who need eyeglasses, but we do see diabetic patients, eye exams, pediatric patients.
Isn't that wonderful, pediatric? Oh, that's
yeah,
wonderful.
lots of kids.
So this is a standard room that a patient would go into?
Right. It's an exam room.
Yeah,
Right.
that's gorgeous. Everything is so brand new.
Right.
Oh, and that's Charlestown and beyond. Okay. So let me ask you, you had mentioned the health insurance providers. What providers can be used down there?
So we accept almost all providers that are part of Mass Health and also commercial insurances. So, and people who aren't insured can come to see us as well. We have wonderful outreach workers who can help people enroll in health insurance. So we've enrolled, I'm not sure how many people, at least hundreds of people.
And
in
that
health
happens right on site.
Yeah.
So if the patient comes in and doesn't have health insurance, we have enrollment officers who can actually help them right there and then.
Oh, what a wonderful service.
To be able to enroll.
And I know that is a concern to many people, even if they've been employed and they lose their job or they're laid off, they lose their health insurance. But especially if they have families, now they can go down there and you can help them through that.
Yes, we are glad to, because it's so important for people to be able to have access to health care, and we're all vulnerable. You know, things happen.
Yes.
The human condition spares no
Called
one.
life, right, doctor? Right.
And we're always there to try to help.
Oh, wow. And now, what are the hours of operation down at New Health?
You can continue.
So we're open from 8:30 to 5, and that's on the medical side, 5 days a week. And then dental and vision services, they have early morning hours. They're open a little bit later in the day, 2 or 3 days a week, and they're closed on Fridays, but they're there 4 days a week.
Well, that's a wonderful service. And now, you said, was it the eye that has the extended hours?
The dental services have extended hours, and the vision is there, I believe, 2 days a week, which is Wednesday and Thursday.
Okay. But that's a wonderful service for dental, because people that do work,
They're
they can
always-
go in
yeah, they
earlier
can
in the
come up to
morning
work,
and
yeah.
there are nothing at night. You know, so this is a really wonderful
it's
practice to
been
have in Charlestown.
And they see kids.
Yeah, they do.
They do see
yeah,
kids
great.
and adults.
All
and-
ages.
Yeah, all
Yeah.
ages.
From
All ages
usually
from.
three on for.
Yeah.
So it's on Vine Street, which is right in Hayes Square. Is there any available parking, or is there parking available in the neighborhood?
Well, there is neighborhood parking, but we also have parking just sort of behind the building on Top Street. We have a number of parking spaces available.
Well, that's great to know also. That's good. So they would go in behind St. Catherine's Rectory, and there's a driveway, and then take a left. And on the right there would be Harvest on Vine Food Pantry. A lot of people are familiar with that. So, well, that's good to know, because, you know, especially if you have a sick child and you want to, you know, you
wanna
don't
have
want to be
access.
walking the baby there.
Yeah.
You want to get there as
course.
fast as you can.
Of course.
What is a patient-centered medical home? How is that different from a regular hospital? You were just explaining that to me, doctors, before we came on. Can you elaborate a little bit more?
Yeah, it's kind of a new concept in primary care, where we work really closely with the patient, the doctor, the nurse, and we have a team. And we really work together to provide the best possible care in the most compassionate, comprehensive way. So all these, basically we want you to feel that you're a real part of your team, that you have a voice.
Good.
We work together to solve problems. We will try to incorporate, if you need extra support from social work or behavioral health, we want to have those people come in and be part of all the people that are taking care of you. And we work together. And you have multiple people that you can talk to. You know, if you call in, and if you're my patient and I'm busy, the nurse, you're familiar with the nurse, you know who that person is. You feel comfortable talking and initiating a conversation with the nurse or the medical assistant or the social worker. So we really work together to do the best we can to help people stay healthy and reach their goals, be it healthcare or otherwise.
Well, that's wonderful.
Yeah.
Let me say this. We have a phone call. Hello, caller. Hello. Hello.
Hello?
Hi.
Oh, hi. My question is, are you accepting new patients right now?
Oh, yes. Well, yeah, we are.
Yes, we are accepting new
Yeah.
patients. We have opened, about 6 months ago, so we are growing, but we're happy to accept new patients, and give us a call.
Do you have something called urgent care? Not like an emergency room, but, in case I have, the flu or something like that?
Yeah, so if you're a patient, we try to accommodate everybody. If you have an illness or you feel sick and you want to be seen that day, we do our best to try to get you in to be seen that day.
Do you have
Right
any
now-
set hours during the day that patients could come?
So we have 2 doctors and a nurse and we're hiring a nurse practitioner who's coming to join us in the summer. So our goal is to be able to accommodate patients who need to be seen that same day.
Right.
And that sort of, and we're there from 8:30 to 5. So within those hours,
Yeah.
the goal is hopefully to be able to bring people in who need
Yeah,
help
when
that day.
when you feel sick, when you wake up and you're not feeling well, that you want to be seen then. So we try to accommodate. We can't always do that depending on our schedule.
But they'll
Oh,
be
yeah,
seen
we try.
as soon as possible.
As soon as possible, definitely.
Any other questions, caller?
Yes, I was wondering if you're connected to any of the major hospitals in the Boston area.
We're affiliated with Mass General and Boston Medical Center. And we have those 2 affiliations so that we can provide access to all the different insurance types. So yeah, we work with specialists at both of those hospitals.
All right, thank you very much.
Oh,
Thank
you're
you
so
for
welcome.
calling. Thank you.
Yeah.
And let me say that we are a live call-in show. And if you want to call in and talk with the doctors, it's 617-708-3290. It's on the screen. So feel free to call in. Well, those were great questions.
terrific.
They were
Terrific.
great.
Wonderful.
They were great. Okay, we were talking about the home-centered, the whole person. We have another phone call. Hello.
Hi, Cookie.
Hi, Jean Tuckerman. How are you?
I'm good, but I have a question.
Sure.
Actually, a couple questions. One, is this new center licensed for emergencies, like you would go to Mass General? My concern is when the bridge is going to be worked on, we won't be able to get across the bridge. I don't think High Street is, and I know Spalding isn't, but they're trying to get licensing so they can have an emergency facility in that hospital. It's very important. The other question was, are you people closed from 12 to 1 like they are on High Street? I think that's such a bizarre situation. With medical emergencies going on that a facility can close down for an hour for lunch. So I'm going to hang up now and listen to the answers.
Okay.
Be well. Thank
Great
you.
Thank you.
questions. Thanks, Jean. Okay, well, I don't know if you know what they're talking about, but the Charlestown Bridge that connects Charlestown to the North End, they are going to redo that bridge.
Oh my goodness.
And I don't think they're going to close it entirely down, but the reduction in traffic flow is going to be
Sure.
great. So I believe what Jean was asking is, are you involved in conversations about extending hours to help people who cannot, because of traffic, reach Mass General Hospital?
Well, not specifically yet, but this is wonderful information for us, and this is something that we can talk to our management about. We are not an urgent care center per se, but we do take, we will see patients that day, our patients that day. So I don't know for sure if that was more, do we have an emergency room set up in the clinic? We don't have an emergency room set up, but you know, if somebody came in and there is an emergency on site, we would have to call EMS to come and help us because we don't have all
But
the
at least the
capacity.
patient would get immediate care, and then you would try to transport them to the nearest hospital.
Yeah, I mean, that's part of our responsibilities, but it's not an emergency room or urgent care as such, because I know there are a lot of urgent cares that are opening up all over the city, and that's not
See,
how we
Charlestown lived through this. We were before the Big Dig. They started the Big Dig in Charlestown.
Oh my gosh, I can
And trying to get out of Charlestown, this was the city square area, was just horrendous. So now we're going through not only the North Washington Street Bridge leading into the North End, they're also talking and going to work soon on Sullivan Square, going into Somerville, Everett, Medford. So these are
On
big,
both sides,
big
yeah.
projects,
Yeah, they're
you know.
huge.
And we're only an
Huge
island,
impact.
and on 4 sides of us is a bridge to leave. And it is a great concern.
Okay.
In fact, it was the CANA project, Central Artery North Area Project, back in the 80s that brought us the ambulance that is stationed down across from the Ladder 9 Firehouse in Sullivan Square. That was part of a gift from the state to help us. And it's been such a useful item.
Wow.
So maybe in conversations
Yeah, that's a
with
wonderful
Jim
point.
Luisi
Yeah.
and others involved that
That's great.
maybe in through Zach, your wonderful PR person who's
Yeah.
hiding in the darkness here.
That's great.
Talk with the city about this and see if you can be involved with
Okay.
helping the patients of Charlestown
That's a wonderful
receive
idea.
care.
Yeah.
That would be
Great idea,
wonderful.
right.
That would
We're
be a
there
great
to
thing that
help.
can happen out of the
Sure.
show.
Sure.
And also, are you going to close for lunch?
We don't right now. We're available. We see some patients through lunch hour, and we stagger our staffing so that we can see people during that time.
That's
We
great.
try to stagger, so one of us
yeah.
is available during lunchtime to
Yeah.
see patients.
Great. That
Yeah.
is good. No, there's only 2 doctors down there right now. I know you're brand new. You just
Right.
had your infancy. And here we are with the 2 of you.
As of right now, it's the 2 of us, and we are looking to expand. So we hired actually a nurse practitioner, a wonderful
Great.
nurse practitioner who is coming to join us
Great.
in the summer. And of course, we are looking forward to build a whole behavioral health department, and as a part of our behavioral health integration.
That is wonderful. Can you explain more about the behavioral health and also the psychiatric department that you're bringing there? Can you talk
The
more about
substance
that?
abuse.
Yeah,
Yeah.
Well, do you want to talk about the behavioral health
Sure,
integration,
yeah.
and then I can talk a little bit about the substance
So
abuse?
we're a primary care office. We're family medicine. We're seeing families. We're seeing all kinds of different patients of different backgrounds. And as a part of the care that we provide, as a part of medical care, we also want to see people as a whole human being to provide and to be able to provide psychiatric care and to our patients. So our goal is to have social workers, therapists, counselors, psychiatrists there, so we can sort of all see a patient and provide services for people.
Wow.
We can take care of both
Yeah,
the emotional
and-
part
and the
of
physical,
health
yeah.
and the physical part of health, integrated, so that you don't have to go anyplace else. It's all part of the same group. In addition, or together with that, complementing that, is also we just received a grant because, as you know, the opioid epidemic
Yes.
is devastating for so many families all over the country,
Yes.
and all over Boston and in Charlestown as well. So we have received some funding to start a program
Wonderful.
there as well that will have substance abuse services, but that is not yet available. That is coming in the future, and we're working on that
Oh, that's
to
well
develop
needed.
that.
Well
Yeah.
needed.
Yeah.
Yeah. Now, do you anticipate having connections with housing for the addict to get clean? It left me what they call them halfway, not halfway. I can't think of the word. I'm
Or
looking for.
transition houses or
Yeah,
halfway.
right. Or halfway, or just detox centers, or.
Well, we don't. We refer, obviously, and our
yes,
behavioral
yes,
health
that's what I'm
team will
thinking, yeah.
work with that.
So you'll
yeah.
know places by the time this is up in operation.
Right,
Yeah.
it'll take
Yeah.
a while, but our goal is to really be able to provide comprehensive care for
Good.
all people.
Now, do you anticipate working with the services that are already available in Charlestown? I know we have people out in the streets talking with those that are addicted, and
Oh, yeah.
good.
Definitely. We're new, so we're just learning about all the wonderful resources that are already there, and our plan is to really
Fantastic.
collaborate and work together. It takes a village, right?
That's right.
Yeah.
That is right.
Yeah.
Oh, great. We only got a few minutes left. See, I told you. So anything you want to bring out that we haven't touched on? And welcome to Charlestown, really.
Thank you.
Welcome,
Thank
welcome.
you for
Thank you.
having us.
Oh,
Thank you.
we're so delighted.
We're really, well, I'll speak for both of us.
Yeah,
We're really
yeah.
privileged to be here. It's been such a wonderful experience so far. And
It's been a wonderful experience learning about Charlestown, learning about the community. There's so much history there. You know, it's been great.
It's a changing
Yeah.
community, always changing.
yeah,
And it's going to be changing even more where you're
that's
located.
right.
Yeah.
With the new development.
The development plans for the housing development.
Yeah.
So, you know, you're going to be seeing another transformation there, but you're so needed. It's great. We're very lucky in Charlestown to have 2 centers at this point.
Yes.
And the additional services that you are offering with dental and eyes, this is great. And the psychiatry department coming, and an addiction substance abuse. That is fantastic, and thank you so much for bringing that to Charlestown.
Oh, well, there are many incredible resources already there. We're just hoping to
there
build
are.
and
There
complement and do our best.
And we do have wonderful people that are working.
Inspiring people.
You know,
Inspiring
daily
people.
on the issues, and not only health, but the other issues that any community has. So this is great. It's been such a pleasure to have you, Dr. Ian, to have you, Dr. Kutsman.
Thank you.
See, now it wasn't that bad. You'll have to come back when you get the other services, okay?
Thank you so much.
So with that, folks, we're counting down the last few minutes. So, so great to hear these great things that are going on in Charlestown. I want to tell you that, you know, before we know it, the Bunker Hill Day Parade will be here. It's going to take place on June 12th. But tomorrow night at the Knights of Columbus, they're having a fundraiser. You know this costs a lot of money. But there's going to be a fundraiser at the night starting at 7 p.m. The doors will open at 6 p.m. Tickets will be available at the door. And the entertainment, you're going to love this. You're going to go just for this entertainment, is our own Dennis Taylor. And he's bringing with him the Ivory Soul Band. You know what that means. Dennis is going to be singing his soul music along with everything else he's so great at. And he's like a new man. He's been on a diet and he's lost so much weight. He just looks fabulous. So get down there. You're going to help a good cause. You're going to get the parade, and you're going to get more bands in the parade, and you're going to get to see Dennis Taylor. So try to get down there tomorrow night at 7 p.m., Knights of Columbus on Medford Street. And as I close every show, here at Charlestown and Beyond, we're dedicated to the Harvest on Vine Food Pantry. And this week I'm told by Tom McDonald that they're in need for cereal and rice. So if you can pay a little bit more attention to that, and of course you can drop those donations or any other non-perishable food down to the Co-op Bank, 201 Main Street, or down to the Harvest on Vine Food Pantry at 49 Vine Street. I know that any donation you give will be greatly appreciated. So with that, folks, I'm going to close out for this week. And until next time, I'm Kathy Giordano, and I want to remind you, Charlestown, remember, take care of one another. Goodbye.